Hello and welcome to News 9 Facebook Live with me, Adarsh Vepachedu. The entire world is waiting with bated breath for a vaccine. But what if I were to tell you that we have all been already using a crude form of a vaccine in the form of face masks? Well, this is exactly what scientists from the University of California have said in an editorial in the New England Journal of Medicine. And guess what? It is the imperfection of masks that seems to be immunizing many of us. So here's what the researchers have said. They have said that the surgical masks and cloth masks that majority of the population is using right now are not perfect, and hence they allow a few viral particles to enter your system. Experts say repeatedly exposing people to small amounts of COVID-19 in this very way may train their bodies to recognize and fight it off, eventually immunizing them. To tell us more about how this really works, we have with us Dr. Vivekanand, a renowned public health expert from New Delhi, joining us live on the broadcast. Many thanks, sir, for speaking to us. My first question, what do you feel about this new study? Do you feel masks may be helping us in a rather unexpected way? Also, tell us more about how limited exposure to a certain virus can eventually immunize us.
Well, thank you for inviting me. This is certainly an attractive hypothesis, and as with every other hopeful bit of news in the COVID-19 times, this has attracted attention. I'm sure that's the reason we are talking here. But I would like to just inject a note of caution. While this sounds very attractive and plausible, and that's the reason it's been published in the New England Journal of Medicine, so far there is no proof to suggest that it works this way. The authors have proposed a very nice hypothesis, which is based on some preliminary observations, but to really prove whether this actually works or not, we need to do studies in which a population wears masks and another population does not wear a mask. And then we compare what happens to these two populations in terms of the level of development of antibodies. That would be the kind of evidence that will allow us to be certain that this hypothesis actually works. So going back to how it might work, if it does, is the point that that you made earlier, that our immune system is built in such a way that if it is exposed to small doses of a particular stimulant of that immune system, or what we call an antigen, then the kind of immune response that develops might be able to fight it off in the long run, because the initial immune dosage are relatively small, so they don't cause the manifestations of the disease, but they're enough to stimulate the immune system to lead to development of the kind of immune response that will be protective in the long run. So that is the hypothesis. But so far as the proof is concerned, we still need to wait for that.
So proving that would require exposing people with and without masks to the virus, and that somewhere down the line seems a little unethical. So you don't see the proving part of it really taking place, do you, doctor?
No, indeed, you are absolutely right. With what we know about the benefits of masking, it would be completely unethical to recommend that a population go without masking itself. So these experiments typically happen sometimes in natural situations where the information is not there, and so people are unwittingly behaving in a certain way. But I don't think that there is any part of the world right now where this information has not circulated that masks are beneficial. So I don't see this experiment actually taking place.
Now, doctor, let's just say the theory of quote-unquote wearing a mask can immunize you really works out. Do you see a possibility of increased asymptomatic infections, or do you see this as a way to somehow variolate or immunize the larger population?
Well, it's different. It's difficult to differentiate between these two situations, right? It is, and it's not really very different as well. So people who do get infected with small doses of virus, they don't develop very severe disease. They remain asymptomatic, and in a way, they are the ones who are exposed to this variolated kind of infection as well. So it's more or less the same story that we are trying to say when we use these two phrases.
So the bottom line really is wearing a face mask and assuming that you're getting immunized shouldn't really become the sort of a general idea, because that itself could make people complacent, putting them at greater risk. What would be your message to the viewers who've just heard you?
my recommendation is to follow the public health advice, which is to wear a mask without worrying how is it protecting you. It is protecting you, it is protecting you, and it is also protecting other people around you. That's really very important, because what we have learned from this pandemic is that if one person is unimmunized or unprotected, everyone around them are unprotected as well. Any town, any state, any country, if they don't win the war against COVID, then the whole world remains at risk. So we should continue to follow the public health advice, which is to wear masks when we are out and about, likely to be in contact with other individuals, maintain social distancing whenever it is required. So that's the advice that we should give, and we shouldn't let people get complacent and assume that they will get some kind of immunity passport if they have worn masks for a significant period of time, and assume that they have become immunized because they have been exposed to maybe subclinical doses of the virus.
Right. Many thanks, Dr. Vivekanand, for calling a spade a spade. There you have it, the doctor himself clearly indicating that this particular study should not make us complacent, should not let us throw our guard down. We should always ensure that our face mask is on us. And yes, wearing it for a long period does not really mean that you have been immunized. This is still a hypothesis, and it will really take a lot for it to get proven. And until proven, we cannot really take anything for granted. Yes, the bottom line really is, once again, wear your face mask, ensure that you are maintaining social distancing, hand hygiene is very important. These are the only known weapons that we have against the dreaded coronavirus. If you've liked the information that we've shared with you, do not forget to like, share and subscribe to News 9 on YouTube, Facebook, Instagram and Twitter. Many thanks for joining us.